I will explore the results of the VESALIUS-CV trial, a landmark study from 2025. This trial represents a turning point in our approach to cardiovascular prevention, focusing on high-risk patients before their first major event. Despite statins, residual risk remains a challenge. They named this trial after Vesalius because it addresses the very fabric of the vascular system, challenging the dogma of waiting for a heart attack before using most potent therapies. The primary objective was to evaluate whether Evolocumab could reduce major cardiovascular events in a primary prevention setting. The researchers wanted to see if intensive LDL lowering works in patients who have never had a prior MI or stroke. The study included over 12,000 participants. These were high-risk individuals, either living with diabetes or established atherosclerosis, who were over the age of 50 and had no history of heart attack or stroke. The cohort had a median age of 63. Notably, nearly half the participants were women, providing robust data on sex-based responses in a high-risk profile including metabolic syndrome and hypertension. At baseline, the median LDL was 122 mg per deciliter. 95% of these patients were already on statin therapy, proving that standard care alone often leaves high-risk patients well above their target levels. Patients were randomized to receive Evolocumab or a placebo. With a 4.6-year follow-up, this study gives us a look at the long-term efficacy of keeping LDL levels low over a sustained period. The results were definitive, a 25% relative risk reduction in the primary endpoint. This proves that intensive prevention works effectively in this upstream population. If we look at heart attacks specifically, there was a 36% reduction in first-time events. This is critical, as the first catastrophic event that often leads to lifelong disability. There was a significant secondary benefits, a 17% reduction in stroke and a 19% reduction in the need for invasive surgeries like stents or bypasses. The trial confirmed no increase in neurocognitive issues or new-onset diabetes. Injection site reactions were rare, at less than 2%. In the diabetes subgroup, the benefit was even more pronounced. Because these patients face higher baseline risk, the absolute reduction in events was even greater. The lower for longer approach was successful. A median LDL of 45 mg per deciliter was achieved, a 55% reduction sustained throughout the study. The implications are clear: we need to move our treatment window upstream. We shouldn't wait for a heart attack to justify using our most potent lipid-lowering tools. In conclusion, VESALIUS-CV proves that primary prevention is better than a cure. Evolocumab is effective, safe, and prevents the first event. It is time to redefine our clinical standards.